Ladies and gentlemen, welcome back to my YouTube video channel. Today I am so excited. I have my friend Charles and my special guest, Dr. Kianor Shah, the legend in dentistry. A lot of people know him from social media, but today I have some time to spend and want to share with you guys what his invention gonna be today. But today I'm gonna focus quickly to introduce Dr. Kiano. Many of you guys know he is the inventor, the founder of company, co-founder. For example, he's a founder of Universal School of Health, Global Summit Institutes, top 100, world top 100 doctor, International Extraction Academy, Academy of Oral Surgery, and of course he's a private practitioner. He got multiple things going on in his life. I am honored to have Dr. Kianor Shah in my podcast today. Welcome, Dr. Shah.
Thank you so much for having me today, Doc. Thank you for the kind introduction.
Beautiful. Thank you for having me as well, Luck. Appreciate it.
Kianor, let's talk about your journey. You know, you've been doing so much thing, global economy of the institution, universal healthcare. What drive your passion about that? I mean, I see that you are non-stopper and you're doing so much, just not just for you. I don't see it just for you. This is something that is more like you are bringing the doctor together, but you must have some drive at doing what you're doing. Would you please share with us, like, in a small podcast today, like why you've been doing something like not the same type of people that been doing, like, like people might focus on just me, but it's not about you. You focus on something different. Please share with us your vision of your, the school that you are planning to, you established so far a couple of years in the past.
Hey, thanks so much. It's a great honor and actually great fun to constantly work with people that lead similar lives as you do. And for the longest time, we have been very isolated in our practices. After professional school, it's sort of the scene started disappearing. And it was nice to be able to solve the problems that we face in our industry by ourselves. We have a lot of people that are skilled, like Dr. Drury is a key opinion leader for various organizations, and he's doing inventions, and we branch off into different things. Some of us go into business, some of us go into law, some of us go into accounting, and to draw all that information back and then maintain a self-sufficient system, I think is going to be important in this new digital age. So we're kind of enjoying that transition, and doctors really like it. They come, they donate the time, they educate, and as you know, Locke, we get tens of thousands of people on a given weekend that come and get this education by industry leaders without any sort of barrier to obtaining it, without a registration process, without a fee, and we've been doing this for a very long time. And when you bring the great minds together and projects start happening all around you, and you enjoy to see that growth. And we're gonna be up to, I think, 700 on the top 100 scenario this December, out of more than 123 countries thus far.
Just want to congratulate you on that, because it's a journey that I start, follow you and, joining your team. But the way you change the world is just not by talking, but with action. And I see that you rally with people internationally. And now we have an international group of friends together in our dream team. It's just beautiful that, the family, you have your family, but this family of the profession, it just become bigger and bigger. And I'm so honored to be part of you guys team. I want to once again congratulate on the work that you do, just not only just nationally, but internationally at the level that I'll be so excited to see the journey is keep going. So I understand that this weekend you're going to be present in Italy, your invention, the universal fasting system, Doc?
Yes, for the first time on a world stage in terms of podium time, and podium time, I should say. But I have a presentation that sort of you're going to get the first exposure to it today. But yes, at an implantology event, the AIO, the Italian Association of Implantology, and a lot of our friends from Europe and from all over the world really come to it and gather. And I'm looking forward to seeing a lot of good friends like Dr. Lerner, who's the president of the Digital Dentistry Society and similar. As you're learning more about the whole digital workflow of dentistry now.
So before we dive into your universal health fastening system and your presentation, I want to just make sure you know those of you that haven't had a chance to follow Dr. Kianor Shah on his global summit, and now it become what the name now,
Global Summits Institute.
And this is the universal education that any dentist around the world, you can get the information almost weekly on Sunday at 9 a.m., correct?
Correct, yes.
Yeah. So it is so beautiful that it's free education, but it brings the doctor together. And of course, we're going to talk a lot more about, the detail, but today, let's just focus on your presentation of universal fasting system. Would you mind to share the podium today?
Thank you so much, and thanks a lot, Dr. Charles, for sitting in as well in this presentation.
Oh, absolutely, it's an honor and a privilege. So, hope to collaborate and contribute. So, excellent.
All right, how's my screen here?
Good.
So, as part of our organizations, be it the Extraction Academy or the Academy of Oral Surgery and or the Global Implantology, we strive to let our colleagues know that are in dentistry that if they're interested in extractions and similar, there's a big opportunity for professional advancement if you get involved with implantology. And about 10% of us are doing it. The number is growing, but also the opportunity with baby boomers coming to retirement and whatnot is growing readily. So the projections keep telling us that this market is going to grow and grow and grow. And what started with wisdom teeth extraction or similar becomes a sort of a career opportunity that you develop. A lot of people need it. My interest has always been inventions. I surrounded myself that were people that were inventors. This is, for example, Dr. Niznik here, who holds 33 US patents. Here's Dr. Wong. He owns about 37 patents. Dr. Mish was sort of a mentor. I loved his first book. Kind of established a bond with him in that scenario of getting a passion for implantology. It's fun. There's a lot of action. You get to learn a lot, and you get to really help people, especially people that are suffering from edentulosum. I think the facts are 120 million Americans suffer from at least one missing tooth. This is your first world scenario. Just imagine what you're looking at on a large global scale, and we need solutions, and inventions and innovations aren't going to stop. Things are just going to improve, because no matter the current inventors say that, hey, in 30 years ago, we didn't practice anyway the same way we do now. Things are changing at such a fast. Yeah. That essentially we are looking at problems and trying to find solutions for them, and recommend most do the same. But here in this scenario, for example, you're looking at all of the different challenges we often face or hear about at conferences or be it in our educational seminars, the complications of having peri-implantitis, which is one of the biggest ones. And if you're into screw retained scenarios, screw loosening, or cement retained scenarios where you have bone loss or inflammation of the gums, or friction grip, which in times of trouble is hard to remove, you always have these choices on how you can go about as a clinician. But how can we improve these and maybe even move our forces around with what we know about biology to create a better scenario where we don't have these problems? So some people are diehard guides, and some people believe them to be very invasive. I think mostly guides are still very well recommended, but I wouldn't expect this to last for the ages to come, because we're looking at patients that want minimally invasive procedures. And this doesn't always seem like an appealing scenario if you have to disclose what you're going to be doing on a patient. Then we have problems with components everywhere, and expensive components. So, is this a professional scenario when you're crawling on the floor because you just lost a $200 screw or implant or what have you? You need assembled solutions, not things that can go down the throat. And if you research it long enough, you'll see how many cases of people having aspired small objects. It's actually quite astonishing, and some of them have dislodged into their lungs because you couldn't put the floss around the instrument, or any other scenario of securing it from falling down the patient's throat. So we do have those challenges, and we got to get smarter and improve with time. So, we talk about one-piece implants versus two implants, then we talk about implants that have a hybrid type scenario where they're somewhere in between. For the simple concept of what we're talking about threads and pitches and surfaces and surface treatments and the different kind of connections and collars, and the debates about micro thread, the angle of the threads, and the cuts in the threads for what sort of connection of the implant and bone that you will have. And then there are the angled solutions, because you, especially in the anterior maxilla or in other areas of the mouth, you encounter angulation challenges if you're doing a bone-driven type philosophy of your implant placement, prosthetic-driven mindset. But the angled buttons come in handy. There's been a lot of research done and trying to figure out what the best scenario is. And today I want to talk to you guys about that. Angled solutions, we have different attachments, we have ball concepts, we have fixed or removable concepts, all with their own flaws, some needing multiple secondary or tertiary parts, some being very small components, some being at set angles, some having problems with removal or fracture. So they all come with challenges. The most prominent ones are from Nobel and Straumann. I don't know which one copied the other first, but it's the same concept that limits you to about 25 degrees based on an oval shape type, odd tape type screw head that you can drive at angulations. I'm not sure what problems that solves because you're still subject to stripping at increased torques, and you're subject to the neck of the screw snapping off. So there has to be solutions where we can sustain these kind of challenges with simple corrections or simple retrieval of the components. So then we talk about connections, internal connections, external connections, conical connections. Do we have lobe shape connections for zirconia that they now may claim to have a stronger scenario that can be done in zirconia? So this kind of knowledge is going to be very handy if you're getting into implantology and you want to understand how it works. It always starts with simple things. A lot of problems we're encountering are micro pumping because all the forces are going to the neck if it's a bone level scenario, and causes a slight opening or rocking essentially of the implant abutment on the implant, and bacteria grow in and they live in there, and they release toxins and causes bone loss. So we have to have other ideas. And then if you're going tissue level, then immediately you have the issue that if you have some recession, you're gonna have exposure of your metal, and it would be an aesthetic nightmare. So again, you lead, you pitch. Your lead is one-time fall around. Your shape, is it sharp? Is it triangular? Is it square shape? There's a lot of concepts there that they consider an implant design. Some claim the best scenario of implants is if they're tapered at the neck, so when you drill, you don't leave extra unused, you don't remove extra unused bone for other kind of ingrowth. Some believe it to be 0.5 millimeters above the bone, so bacteria, not the same flora of bacteria would grow in. And some believe it to be subcrestal, where, you know, some complications shows that the bone goes all the way down there. Most times it doesn't. It depends on who is doing the study. And then there's the concept of the universal fastening system that I'd like to share with you guys. My passion was always in trying to figure out a better way than all of these components, the angled abutments and the screws, and then secondary screws, and then the cylinders, and then having the mail at times, if I'm not carrying the inventory, having the mail arrive at my office in time so I can execute the procedure. And if one component was missing, it would become quite a bad day if you didn't have a backup in the office. So it's always those dynamics that also play a role. But having something that's universal, but at the same time has security features and allows you to restore your whatever two bodies that you're trying to connect together, based on a gear and wheel mechanism, would eliminate, in our belief, a lot of those challenges that we hear about. So not using friction grip, not using cements, which is essentially an enemy of the tissue. You're creating a scenario where you can also lock these fasteners in and apply much more torque than you would conventionally be able to do on a hex type scenario inside of a conventional screw. Be it the Phillips screw that came out, and subsequently a Torx driver. There hasn't been much significant innovation in a consolidated industry of fasteners. So it's time to look at different ways we can connect two bodies, because now you're in a position, if you have the ability to come in at 90 degrees and 135 degrees, you can build structures and products that are more efficient, because you're placing your fasteners where you want to place them, not where you have to because you need straight line access, be it from infrastructure to ships to the eyewear that you might have on, the cell phone in your pocket, the automotive, the defense, the aerodynamics, and so on. Most of the world is kind of held together by fasteners and glues, and fasteners is a much bigger industry than glues itself. So their challenge is stripping in the industrial side, not just axis and angulation, but having a dual connection, which now has come out of dentistry, which I will demonstrate. But here's a short video. Let me go ahead and tune this down a little bit. So you have the ability to retract it. So you can seat something, retract it, and then drive it back down, because you have to get your hex to go in there, which is prosthetically guided into place. And you're going to end up around the cingulum above the tissue with access that will allow you to be able to close it up and readily enter it again. And also in the center of the prosthetic, not having that metal, because it drives the nut, drives the shaft back down. Now you have translucency in your crown again. You don't have to worry about using some sort of a blocker to get your metal to look kind of white while you build on it. So the transparency play comes back into the discussion as well. But let's go ahead and here, as you come in, for example, in this first slide, you would have a carrier to bring your shaft in, which engages the nut that goes in, all at the lab level. The dentist doesn't do this. The dentist has 3 different access points: the occlusal, the buccal, and the lingual, to get to that nut or to get to that hex on top of the shaft to remove the entire complex. This is assembled at the lab level, and you end up with this kind of a scenario where you also could inject material like composites into this area where my mouse is pointing towards. At this stage, after you've driven the nut back down, once the hex first seats as guided by your prosthetic with a single unit or in a multi-arch. So in a multi-arch, it doesn't really matter where you come in. You can come in from the buccal or lingual, and you don't have to ever compromise the occlusal surfaces, because you know what happens when they build all of these long channels up into the prosthetic and into the teeth. It creates microfractures, and at times when you have them in function, these microfractures expand and cause the prosthetic to fail. So if you don't have to put these holes into these teeth, you have a lot more strength on the teeth. So something else will have to give, and if the screw is not giving, and your prosthetic material isn't giving, you, or at least I should probably better use the terminology of resisting, you have a very desirable situation with full arch prosthetics. So here in this video, for example, it takes me over an hour to take off a prosthetic and clean it for a patient and put it back on. With this, we could use the doors to these access points in the lingual or buccal. Literally, it can be plugged with some PEEK material, or you could actually do a conventional Teflon, cotton pellet type composite on top of it. You flow some resin in there, you're done. And you can readily make these prosthetics on a printer right now, and we're soon going to have our zirconia milling strategy that we're working on. Let's go to the video so you guys can quickly see this. So you can click it into place in this case, and the screws retract, it drops everything down, and then you can go in with your driver and engage that guide that you have. So it would be easy for a clinician to find it and quickly engage it. And then you start driving these wheels down, and the prosthetic starts seating. And it will let you know when you have reached your limit. This is on a preset 40 Newton machine, and the engineering is done very finely. So actually 55 seconds on this dentaform to get a prosthetic on, secure it. And I would assume the same amount of time to remove it, but that's not what the video here will show. So this is very desirable to get something like this sent to you, where you don't have to start compiling things and all of these things about verification jigs. And I mean, with what we can achieve today with scanners and printers is phenomenal, and it's improving every year. And this could be a solution for a lot of people, because, you know, if you have to pay like $10 for materials and you can get these components pretty cheap, and you got a printer sitting there, you can start cranking these out for a lot of people at reasonable prices that make you the kind of profit that you're looking for, but at the same time being able to service the overhead and getting the patient the best kind of, at least not a Ferrari, but maybe a BMW type scenario that at least will get them started. So that's also another consideration of why we're doing this. So I, as an implantologist of 16 years now, I don't like holding much stock, although I do. And every implant company has ever come around, they all have a pitch about what's gonna, why theirs is better. But in my opinion, I haven't seen, you know, the conical connection that was nice, and then some concepts with tissue level scanning and then not having an abutment, or which Dr. Drury was telling me about, another implant system that snaps on and can be removed with a special tool.
Yeah.
Induction, yes. So great ideas, and as these ideas roll out, they'll just get better and better. But it's not always going to remain the internal hex and that kind of a situation. So I alluded to some of these things about the long channels and teeth. Aspiration is very important, as we discussed, and then also you know, hygiene. Depending if you know what your full height is, you adapt your as applicable to all implant systems. This can be adapted. You can decide which cuff height you would take on the abutment. So you could also have a hygienic area under the prosthetic if you want to do like a high water or something similar, depending on what type of case you're doing. So I printed this one out with a next dent, and they now have, which what I found very interesting, permanent inlay onlay crown material that you can print with. I haven't had any experience with it. I'm very curious to see kind of a longer term study to see what sort of tissue response you're going to get from that. But apparently they're using these for final restorations of all sorts. And but for this full arch, it was a very quick ordeal. With these printers, they're making all kinds of cool stuff now. My practice has completely transformed since I brought in the scanner, and I brought in this, CT we've always had, but between the CT and the 3D scanner and the printer and the endo toys that we have now and the laser, it's fun. I don't pack much cord. I go in there and I just do a little gingivectomy, then I scan it, and next thing I know, I get beautiful margins. There's almost no remakes. It's actually fun, those kind of headaches kind of go down a little bit. So I highly recommend that if you are one of those guys. I was one of those guys. I'm like, yeah, I'll keep packing cord and I'll get my margins. And I realized what a huge difference that makes in a practice. If you just adapt and take a couple hours and learn it and practice with it a little bit, and it's a great investment. But this is how we did the case. For a Dentaform, obviously we just ran it in brass, and I had a designer design the prosthetic with buccal and lingual access to it, and mock it up, and the computer adds the software, adds the bases, the structures. Boom, for $10 worth of material, you just ran this thing that doesn't have any holes again in the teeth, and it's much more printable additive material that has less chance of a fracture that you would normally see, given maybe even full arch zirconia restorations that have to have these holes in the center. I've had plenty of those guys bust in half and would have to be remilled with a new puck and add support added. So you're in a much different situation now. You're coming in from areas that are reasonable as determined by you and the lab, and they run this thing. Or if you're doing it in-house, you just take the doors and insert them into your 3Shape or whatever software you're using, and these doors will be blocked out of that area, and you have that circle, and it gets looted on by the laboratory, and they send it, and you go to the mouth and you place it in minutes. There are two ways to do the prosthetic part for different companies. You could do tissue level scenarios if you have drastic angulations. A lot of times you have good straight angulations, but if you have drastic angulations, you can use a retractable feature to seat it first, depending on the case, and be able to also readily remove it in the same fashion. So here I'm almost coming to an end, guys. So here you're looking at the tray. It's very easy to take those support structures off, and then you stain it with different and gingival shades, and you customize it depending on the skills of the operator. And then the glazing process is sort of the final cure of this mechanism. You get something like this. So, I mean, it's a lot more wiser to not make your patient waiting area, and sort of bring them back the next day or in a couple of days when you have time to make sure you have it. But a lot of times, if you have a designer, they can send the file directly to your printer. So you scan the thing, and then you take that SCL file or what have you, depending on whatever file you're working with, your lab. You send that over, and they design it real quick, and then you approve it, and they send it to your printer via the internet, and it lands on your printer, and then you have it. X amount of time later, you just go pick it up, clean it up, and go. So imagine if you're doing these large, massive MODs, and you're doing those DOs, and then there's some companies that are willing to pay for inlays and onlays, and you have this thing in the back, and you can actually do an onlay there by maybe temporizing it with easier removable material, and there's plenty of them. You have a scenario where now you're doing a lot more inlays and onlays versus doing these large composites and teeth where there's going to be shrinkage and failure around the tooth essentially. So that's it, guys. That's the short version of what I've been working on and where the passion lies, and what we're trying to solve.
Awesome.
Beautiful.
Awesome. Beautiful.
I would commend you on, you're thinking outside of the box, right? You're differentiating, you're causing disruptive innovation by creating techniques and modalities and services that are going to benefit the dental profession. So, and benefit the patients and quality and quantity of care and improve their lives. So from an altruistic standpoint, I think it's fantastic that you're doing that, because we need people like you that are thinking like that to make an impact on people's lives. So I commend you on that. Interesting, what I saw was you talked about collaboration to labs, really is what you're talking about too, when you're talking about them designing and printing for you, making the design, and then all of a sudden you come back and it's printed, and that's
Yes,
beautiful, right? That's like
everybody
taking
wins.
a little bit of the stress out of us, and teamwork, right, to be more efficient in this. And you can do it yourself, right, but you can be productive and still be working, and then still have it being made in-house, right? And I think we're going to see a lot of that. We're going to see a lot of that in that sector for 3D printing and fabrication. We're going to see that maybe going in the liner business, and we're going to see some, I know some stuff that's coming. I think that you also touched on the ability to provide emergency services for patients in real time, like that, maybe, that patient's traveling or going somewhere, and then you're able to make a new one, where otherwise they're going to go on vacation, or they're going to go somewhere, they're leaving the country, and they're, no, they don't have any prosthesis, right?
Correct.
So,
Correct.
or maybe you had a design flaw in your treatment planning that you didn't think about something, and now you're beta testing it with these prosthesis, and you realize, oh, this is not going to work. It's like making veneers that are too long, and putting the finals in, and someone lisping and can't enunciate anything. You'd rather know early than putting the permanent ones in, right? So you get to beta test. Oops, your microphone.
Precisely, and especially if you have to remake that, have a digital file and can
go. Oh, it's expensive, right? The zirconia is expensive to do the final.
Yeah, but I was thinking more along the line of lays and onlays and the smaller stuff that you could readily do in the office, and also provide emergency services under. Especially I'm in Palm Desert. I get a lot of Canadians that are here on vacation and whatnot. And
oh yes,
you have to act very fast and have the ability to communicate very readily with the labs. But you're exactly right. The amount of loss that you would take by not working and sitting there designing cases is maybe the solution to the whole CEREC issue. You have somebody design it for you and mail it right back to you, and you can quickly mill it or print it, and there you go.
And when you're in Palm Desert, for example, someone comes to you, they have no crown, they have nothing, right?
Yes.
And then they come to you. You don't even need to make a temporary, right? You can go straight to making a new crown, right? And
I don't particularly do that, but they're usually here for a couple of days, so I can work with the lab very quickly.
Okay. Yeah.
I just got another printer in, and we're doing more cool stuff with it. I want to get into making my own guides. If you submit your CTU to these guys with your scan, they can also do the same with your guides, which I find to be very cool for, like, especially even the single units or the multi units, bridges and so forth. Would be cool to have a guide as well as the technique that I'm using currently.
Well, have you ever utilized a reverse engineering technique? Like, for example, someone comes in with an Invisalign tray, and they're bummed because all of a sudden that Invisalign tray is going to be useless because now a new crown is going to fit there. But no, you could take the Invisalign tray, fill it with temporary material, put it in the mouth, biocopy it, make a new crown that will fit perfect in the tray, and you utilize that. So this is the digital age, right? With this technology that can do things that are totally outside of the box, that or a partial that has a clasp that fits perfect when we biocopy.
Yeah, that's smart.
Right?
Yes, that's what we can achieve now. You can also scan your prosthetic. If you're talking about reverse engineering, you can 360-degree prosthetic that you have in the office, and instruct the lab to improve this and that on it as you. It's really cool, the things I've been able to do. I was doing one case like that, doc, the other day, where the lab just tells me to scan it 360 degrees, and then the temporary amazingly nicely fitting on the multi-unit.
What was the why you did? What are the advantages? I mean, I kind of understand some of the advantages, but if you were to summarize it, I mean, this was any product is usually because of a problem that you come up with a solution, right? So obviously there was a problem that you saw that you came up with a solution. So the main problem that you saw that you're trying to solve is what?
Well, stripping, screw loosening, access, aesthetics, and the ability to retrieve rapidly. Some of those thoughts and challenges would go into the thinking process of how we can achieve this. And then on top of that, you naturally have the biological considerations of understanding what's going on down there.
The cement 2 aspect, right, as well?
Yeah, I had another case that was cement retained that this Canadian doctor called me on and was like, hey, you know, one of your crowns got knocked loose. And I turned it into a screw retained by putting a hole in it from the top. But when I took it off, there was a little bit of cement down there. And he said, send me a picture. And I'm like, oh my God.
Right.
And you know, how you gonna? I went back to this to the PA I took after we put it on, and there's nothing there.
Because it's buccal or lingual, probably, right? It's on the, you know, it's like it's hidden, you know.
Yeah. So this is a problem for us. We gotta find better solutions for it.
Correct. And so, well,
Kianor, I have a question for you. So your vision is you go into disrupt the industry of implant dentistry, where this system can be used with all the implant system out there. Correct?
Correct. So that's hence actually the universal fastening system. The name was going to kind of give a hint that not only is this applicable to one system of any kind, it's applicable to being adaptable to all the other systems. So its application is going to be having this mechanism and adopting any implant connection there is, so you can quickly be into the prosthetic and full arch restoration. Basically, the lab would only need a straight line impression, manual or digital, and would be able to return a prosthetic that seats within seconds, say, if you're working a little slower in minutes, versus the lengthy, sometimes painstaking processes we have to go through to get a prosthetic on and off. And if it's not screw retained and you're playing with it, with trying to find the hex and putting this 2mm screw in, and sometimes it goes, and sometimes the screw interferes with seating of the prosthetic, and then you got to take the screw out of the butt. All these things that come up, and then somebody's swallowing an instrument, and you just paid all of this money for all of these parts to the tunes of hundreds and hundreds, sometimes thousands of dollars in a case. From multi-units and angled abutments that are going for $200-300. It's just crazy. So yeah, the inventory, because these the way you secure the survival of your business is to have constantly new products and create what's called engineering obsolescence. In the same scenario, these guys, this is something they would learn in business school. And in some cases, they have to keep you in so many different categories with so many different components and parts. And without those parts, you're bound to their system, and you got to use their techniques, and you got to buy from them. But in a scenario where you have a tamper-proof system, where you need an actual driver to be able to remove it, because it's not the Phillips and it's not the Torx, it's its own unique system that could be applied. So this was a 90 degree. So I can give you guys a little taste of this other document that hasn't been shown. It relates to the detailed patent. Let me open this up. If I may share my screen again.
Yeah. You should be able to do it.
What thing from business school did you learn that you applied towards this, would you say? If you had to pick one thing that you learned. If
you're the kind of person that wants to get out of your current full-time scenario and start something on the side, some go into innovation, some go into law, some go into accounting, but it's cool to have that second or third thing in your pocket. So for me, innovation was very important. We have now I kind of learned to find problems and then providing solutions for them. So every convenience that you have in life, and many, many million people or sometimes billion people benefit from, or innovation that came out of a shower sometimes. Doc,
You're using my example.
That's right.
It's a good one. It's a good one. We shouldn't make fun, but yeah, it's you should I share that or no? Or you want to share it? I can share it.
no, go ahead. That was a good story.
Oh, it's a guy I was online with. It's he invented this attachment for implant system that's a ball attachment. It's round, smooth, and he's a great guy. And you know he's a lab guy, and he spent years struggling to try to figure out solutions, right? And he came up with a solution. But the funny thing is, he's telling me the solution that the ball thing, he did it because he was in the shower and he's bald headed, so he was rubbing his head, and he said,
Yes.
"Oh my God, I have the answer." Right?
Yes.
It's a ball clasp, right? It's a ball solution, you know, which is
Yeah,
rotational, right? So I almost
Right.
couldn't hold it together because it was so funny, you know. He's like telling us this situation that is real, right? It's just being human, you know. He's saying, "God, it's my head."
So, but
in my
his head was somewhere else
He
too,
used his
Doc.
head, you
Yeah,
know.
he used his head. He was thinking about an innovation, the shower. I mean, then it hits you one day because you're gonna keep. It took me 4 years. I'm a walker, and I walk, and I think my day out, or mostly in the mornings, and constantly think about something that I could improve. So, what they teach you in some MBA schools is that you find problems that you encounter during the day, whatever makes you life tough. And if you want to kind of get into innovation and building a business, side business for yourself, this would be a scenario where you could create a solution for it. And you have to do your research, see if the IP intellectual
Market
property
analysis. Yeah.
on. There's a whole process, and gladly answer any questions for any of our colleagues that have that. But in this scenario, I wanted to show you a couple of different concept. This is a very, very, very lengthy patent here. So this one right here are internal connection fasteners are giving you the opportunity to lock the screw in a shape where it's impossible. But I shouldn't say impossible. I should say it resists very strongly stripping.
No
So
stripping. Yeah, look at all the surface area, right?
yeah, yeah, you get more
Incredible
surface
surface
area, and it's impossible to essentially grip that. So if you got scenarios where we have the nut version of it, the washer version of it, the nail version of it. You have sort of the screw and screw, the self-tapping concepts. You know, the drivers, the jammers, the anti hex elements, and on it goes. This goes on.
Can I
So
ask you something? Is
yeah,
that situation that you just showed me with that driving system, how intricate that is with all those internal parts? Is that something that is in the already existing, or did you create that?
I created all of these different fastening mechanisms. Like I
So
said, there's
can't
not
that be
much
used in other
innovation.
industries?
So my hope is that we can get into eventually after the dentistry. I think the next route is orthopedics, because they
Yeah,
can't figure out their angulations with shoulders, knees, hips.
absolutely.
The screws come loose. The patients have to get hips replaced 5 years at times. So orthopedics would be the second stage, and then once we get this through the FDA predicate route, then you can come out and say, okay, here I got now verification of this on the regulatory side, and then you go into industries such as hopefully everything from automotive to
Yeah, that 100%, right?
everything. So imagine.
Did you think that too? Did you think that too? Because when I saw that, I said, "Oh my God, that's a universal solution for."
Let me show you something else. You know how cool it would be for having the ability to pick up a screw on the manufacturing floor.
With the magnet?
Let me see if I can get this to show you. So
you
you
can use it
actually,
magnetically.
yeah, not just magnetically, but having the ability to have it and be able to drive it and carry it to your
Right, and not have fall off.
and not have it fall off by a robot, and then just go into a hubcap or like like a wheel,
Oh
or
yeah, yeah.
and then you got this thing that's just so imagine what we can do if we get the right
Wow.
forces in there that we understand. Now you have a
Yeah,
situation where you don't have, and this came out of a dentist's mind because we deal with internal and external connections all the
yeah,
time.
but that's amazing. Yeah,
And lecturing on that. So the ability to not strip and the ability to not
and the
to
torque,
have a
and the torque.
friction grip and the torque gives even our conventional or 0-degree fastener an edge over any other fastener. And I would
Do you,
wage in.
do you know what I think of when I see that?
What's that?
Do you know what comes to my mind? The Formula
Oh,
One car, the Formula One cars.
oh, really?
Do you know how fast the guys come and they change the tires?
Yeah.
Right?
Oh, wow.
Think about this with changing tires and stuff like that.
So here's that, and then I'll show you. Yeah, that's a great idea, Doc. Now I'll show you the if I can. I don't know. It's very hard for me to display this with this background, but so basically, this is the life-size version. I don't know if you see it, but as I rotate, that spindles, and that's also carryable to your final location by the driver.
Yeah, you hope that doesn't happen.
Well, yeah, you hope that doesn't happen, but in reality, once you do your testing, there's different. Let me see here. This, but you wouldn't want to carry it because we don't use a driver. This is another point. So you wouldn't actually, for the single unit, carry it, which you could. But what you would do is you have only a latch head, so there's not really a driver
Yeah.
in the picture. All you need is your latch head, so you don't dislodge that instrument in the patient's mouth. This is inside your prosthetic, by the way, so it also will have the support.
Did you have a mechanical engineer that helped you with the design of that screw?
I actually have all the engineering plans of the functional prototypes we have built. It was all predicated on this gear and wheel mechanism that we essentially patented in every shape and form. It's patent pending at 5 different
You have a
scenarios.
patent on the screw though, right?
We have 5 patents pending, 4 provisionals and 1 utility under the PCT, which is sitting in Geneva. So 4 US ones and 1 in the WIPO down in Geneva, the world. That thing is 157 signatories for that one in terms of countries. So currently worldwide, we have rights to this concept for quite some time.
That's beautiful.
Dr. Shah, what an honor to have you spend this platform and share your little information about what you're going to present a few days from now in Italy. It was an awesome presentation. I can see that your brain it keep working, and I follow you for your Facebook, and I know that so many things in your brain keep going, and this is just one of your project. What an honor for you to just share with us on this platform today. And not only that, you're gonna bring up to change the way how we do in dentistry. So I'm hoping that the universal fastening system going to be disrupted kind of system for our profession. I do dentistry every day, implant dentistry every day, and I do understand what exactly you're trying to do to change this kind of way of working, where we have to order every single part of each different company, and then eventually if we don't use it for a while, we're gonna lose all of that stuff because we don't know where to find, and it's just gonna be a lot of inventory. But now we have a system that would definitely going to disrupt the way we deal in it. Just like you mentioned about 3D, the scanner system, and how your stress just gone. The laser system make your stress gone, and this universal fastening system going to reduce the stress for the dentist. And so I can't wait to see the process that we're gonna bring this out to the market and just utilize for every single office, whether it's the one in the United States or in other country. So what an honor for you to share with us sometime today.
Yes, thank you so much for having me. It was great fun. Also, our prep session and our discussion meeting Dr. Drury, and we are very fortunate to have you in the dream team and helping us with all your wisdom about social media and training and educating our colleagues in that regard, which is important. And thank you for having me on the show. It was an honor.
If we were to ask you one question, if you were to pick a book that you say is your favorite book, what would that favorite book be?
I think I had it in the presentation. You talking about academic?
Yeah, business related, invention related, personal related. What's one that has an influence that you've had on that for you that you've had significant influence?
Let me see. I got my library right in front of me there. Let's see. I got a one that I read from time to time.
Is there one that you go back to?
Yes. If it hasn't been, it's down here somewhere. Here it is. Let me see. Yeah, I read this one. I think it was back in. Hold on one second. It's the million. No, it's not right here right now. It's in the other bookshelf. But there's one I go back to quite often from college, and I haven't read it in a while. It was let me see if I recall the name. No, not the million. It'll come to me. I'll let you know. But clinically wise, it would be definitely Misha's book that I was putting up. Did you catch that slide?
Carl Mish's book?
Yes, the first prosthodontic book you ever written. Did you catch that, Doc?
Oh,
That slide.
No, the slide you haven't shown it.
Here,
It's
this book right here.
oh yes, yeah, absolutely. Yeah, this
You remember this one?
Contemporary Implant Dentistry.
yes. Carl Mish, it's wonderful guy.
Yeah. So this one is what got me really interested and excited in implant dentistry. And if you took the diplomate exam at the ICOI, if you knew that book, you'd probably.
Dr. Shah, thank you for joining us
Perfect.
today.
Thank you so much.
I
Thank
hope you have a safe trip to Italy, and hopefully it's going to be live broadcast, or it's going to be in the closed section.
I think it's a closed session, but
Okay.
I'll let you know how it goes.
Beautiful.
All right. Thank you again. Take care.
Take care.
Thank you, Charles.
If you can stay online for a second.
I have to turn off this end the conference call first, okay?